Two new breakthrough drugs for arthritis in dogs and cats. Librela for dogs, Solensia for cats. Many pet parents, they're having some serious side effects. This is what you need to know.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Hello, welcome back to my channel, and if you're new, welcome. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book. Recently, the FDA, they approved two new arthritis drugs for dogs and cats. Number one, we have Librela, that's for dogs. Solensia, it's for cats. It's made by the animal health company Zoetis, and it's turned out to be multi-million-dollar drugs. These drugs are unique. They're actually an antibody called an MAB, a monoclonal antibody, and they're targeting a specific protein called NGF, or nerve growth factor. Nerve growth factor is a key role in underlying arthritic pain. When you look at the whole pain cycle, especially pain related to arthritis, it's that nerve growth factor, when it's released, causes additional inflammatory pain mediators, making pain so much worse. So it's really different than any of the other anti-inflammatory drugs, any of the other drugs that we're using for pain in our dogs and cats. The commercials, they look great. Your dog, your cat, all they need to do is visit your veterinarian. They get a little monthly injection. Yes, you need to see your vet once a month. And they claim that up to 80% of animals are responding really well. And honestly, I sure see the appeal. For instance, my last cat, Murray, he was horrible to give pills to. If I could just give him a monthly injection when he had arthritic pain, I would like to do that, knowing full well, though, if it was safe or not. Or many of our dogs, they're just not keen on pills. So wouldn't it nice be able to just give them a monthly injection and ta-da, they're pain-free? But Librela, Solensia, they've been out in the EU, that is in Europe, since 2021. And that since that time, they've reported over 15,000 adverse events of Librela. They've seen over 8,600 adverse events reported for Solensia. So these are unwanted, unexpected, potentially serious side effects seen from these two drugs. Some dogs, they've experienced neurologic problems. They've been wobbly, ataxic. Others have even had seizures. Some cat owners, they've experienced marked skin disease, this excessive scratching to the point of self-mutilation on the side of their face. They've seen lethargy, that's acting weak, behavioral changes, drooling, urinary incontinence. These dogs, they're just dribbling urine all the time. Inappetence, increased drinking, increased urination. These animals now have kidney disease, hind end weakness, an inability to walk, organ damage. Other pet parents, they reported vomiting, lameness, UTIs, pain over the injection site, skin cysts, and in some cases, even death. According to VIN, Zoetis, the drugs manufacturer, they claim there's been millions of doses administered, and the number of adverse events, i.e. side effects, is pretty minimal. They say the veterinarians as a whole, their experience with Librela, with Solensia, most of the time they're saying it's positive, but some of them are reporting they are seeing some side effects. One of their big concerns is a side effect of neurologic disease in dogs. But Zoetis claims risk of side effects, the number of adverse events, it's really, really low. They say it's less than 0.1%. Even the FDA, they responded to some of these adverse events, and they directly sent a letter to Zoetis. They said that Zoetis made false or misleading claims about Librela's efficacy. The company then made some changes, including that the drugs, they could cause side effects. So we know that these monoclonal antibodies in the drugs, they're binding and stopping nerve growth factor from interacting and triggering pain receptors. But nerve growth factor, as you can imagine, it's not just there in the body because it's triggering pain receptors, it's causing nerve growth. So imagine your animal has nerve damage. Potentially those nerves are not going to then potentially regenerate because that factor is no longer present. They say that nerve growth factor, it's a key component of just nerve development in fetuses. Some scientists are now saying that nerve growth factor contributes to healing in general. And many of our dogs and cats, they can have certain underlying disease. They may not heal when on these drugs. So they give the example of a dog, for instance, going in and seeing a veterinarian. This dog is limping. They get diagnosed with osteoarthritis. They stick them on Librela, and they're getting worse. Maybe they had some other underlying cause. Perhaps they had an ACL injury. Well, number one, the Librela is not going to help them heal. In fact, it may make them worse because now that tendon, it cannot heal on its own. And that's what some veterinarians are reporting. I mean, some of these animals are on these drugs, on Librela, these cats on Solensia. They have underlying disease and it can be getting worse. So what they're saying, when Zoetis did their safety studies of these two drugs, they tested these on animals that were healthy. They didn't have any other comorbidities in terms of a cat that, yeah, he had osteoarthritis, but also kidney disease. Or a dog who, yes, he had osteoarthritis, but also say it had a damaged nerve, he had some type of neuropathy. They didn't test that on those animals. So that's where we're seeing some bigger problems, especially in certain select animals. Many pet parents have reported their animals becoming urinary incontinent after Librela, or their cats developing horrible skin disease, in some cases needing to be euthanized after being on Solensia. And then the neurologic concern, seeing these animals that have potentially, i.e. underlying nerve damage, they're on this drug, it gets worse, and or perhaps it's affecting their brain, triggering seizures. So what do I think? Should you consider using Librela for your dog, Solensia for your cat? So the first thing I'd say to ask you, have you explored and gone back to the basic using any of the holistic alternatives? Have you started with weight loss, for instance? Is your dog on a good quality omega-3 fatty acid? Have you considered heat therapy, cold laser, even the injectable glycosaminoglycan, Adequin, acupuncture, acupressure, CBD, 95% curcumin, boswellia, magnesium? There are a bunch of holistic options. Many of those are relatively inexpensive. And number one, so I just first really encourage you to go down that holistic route before you jump to these big fancy bang new drugs. But if your dog or cat is in serious pain and nothing else has worked, you've gone through that gamut of holistic options, and they don't have any other underlying comorbidities in terms of they have normal organ function, especially normal kidney and liver function. And they don't have underlying neurologic disease, i.e. an older dog with degenerative myelopathy, or a history of seizures, or an ACL injury. If that's the case, you've gone through some of the other conventional options as well, maybe the anti-inflammatories haven't worked, and you've got an animal in serious pain, yes, then consider these. But look at all of your options. Some of the less serious conventional options, i.e. the gabapentin, those whole array of holistic options that we just talked about. Go down those routes first. Try some of those things first. If that all fails, consider it. But what I feel with many of the animals, that if you try some of those holistic options, you're going to find a few that are going to be really beneficial for your dog or cat. In my general experience, is they're going to be so much safer than these guys. And would I be using Librela on Tula, Solensia on my next cat? No. Would you inject yourself with a monthly monoclonal antibody? Pretty thinking probably not. Wouldn't inject myself. I'm not going to inject my dog, not going to inject my cat with a monthly monoclonal antibody. And if the poodle gets limpy, she responds super well to CBD. Safe for your dog, your cat, even you. Thanks so much for watching this edition of Veterinary Secrets of the two new arthritis drugs for dogs and cats, Librela and Solensia. Click up there to subscribe, hit the bell to sign up for notifications, then when you click that link directly in the box below, I can send you a copy of my free book.